In America, one trip to the hospital can change a person's life, not only because of the illness, but because of the bill that comes after it. Imagine going to the emergency room for a simple injury, staying only a few hours, getting a few tests, maybe some medicine, and then weeks later, an envelope arrives in the mail. Inside is a bill for thousands of dollars. For many Americans, this is not a shocking story. It is normal life. The United States is one of the richest countries in the world, with some of the best doctors, hospitals, medicines, and medical technology on Earth. But it also has one of the most expensive healthcare systems in the world. So the big question is, why is healthcare so expensive in America? Statistics show that more than 90% of the United States population has health insurance, mostly from private companies. Meanwhile, in other developed countries, this rate can reach up to 99%. Most healthcare costs in the United States are market-driven, and tend to increase. According to the Centers for Medicare and Medicaid Services, in 2022, United States healthcare spending rose by 4.1% to $4.5 trillion, accounting for 17% of the gross domestic product. On average, each United States citizen spends nearly $13,000 per year on healthcare. Here are some of the reasons why healthcare costs in the United States are among the highest in the world. The complex healthcare system. The United States healthcare system has many rules, funding sources, and out-of-pocket costs related to different types of health insurance, whether paid by employers, private insurance, or government-provided programs like Medicaid and Medicare. Citizens must choose between various coverage levels, which may or may not include prescription drug coverage, deductibles, copayments, or coinsurance. Providers must also navigate a multitude of regulations regarding usage and reimbursement. System administration costs are frequently cited as a major reason for excessive healthcare spending, amounting to around $1,000 per year for each citizen in the United States. Rising drug prices. According to Investopedia, Americans spend nearly twice as much on pharmaceuticals compared to citizens in other developed industrial countries. High drug prices are the single largest cause of overspending in the United States. In Europe, drug prices are regulated by governments and are often based on the clinical effectiveness of the medication. Meanwhile, in the United States, private insurance companies can negotiate drug prices with manufacturers. However, Medicare, the federal insurance program for people over 65 years old, which pays for a large percentage of drug costs, is not allowed to negotiate prices with manufacturers. On average, each American patient spends $963 on prescription drugs, compared to $466 in other developed countries. Total spending on prescription drugs in the United States reached $378 billion in 2021, an increase of 7.8% compared to the previous year. Healthcare workers have high salaries. The average annual salary of an emergency room doctor in the United States is $310,000. This figure is much higher than the average in other developed countries such as Belgium, Finland, and the Netherlands, which ranges from $160,000 to $200,000. American nurses also earn more than most of their colleagues in other developed nations. The average salary of an American nurse is around $77,600, while the same figure in Australia, Israel, and Ireland is around $50,000. High service fees. According to a report published by the Healthcare Cost Institute in 2022, the prices of inpatient services in the United States are extremely high compared to other nations. For instance, hip replacement in the United States is the most expensive in the world, costing $28,000, while the second most expensive country, New Zealand, requires $16,600. A cesarean section in the United States costs more than $11,000, whereas in Switzerland, the second most expensive country, it is nearly $8,000. Finally, CT scans and MRI scans in the United States cost $553 and $580 respectively, compared to $78 and $120 in Spain. So what do you think? Is healthcare in America expensive because of insurance companies, hospitals, drug prices, politics, or all of them together? Share your thoughts in the comments. And if you want more simple explanations about the systems that shape everyday life, follow Daily Brief News for more stories like this.